Fentanyl and the addiction epidemic is still going strong. I am having a meeting today with my friend Jeff Breedlove from Georgia Council for Recovery, and we are going to talk to you about an event on Tuesday, November 19th that we would love for you to show up at. Hey Jeff, how you doing today?
Doing well, Jamie. How are you?
I'm doing great. Still fighting the good fight.
Absolutely. Thank you for all you do to lead on our issue for the Georgia recovery community.
Absolutely. And we just need to keep bringing awareness because, as things keep going and things keep progressing, we're grateful for all the things that our great state of Georgia has done and our nation. And, we can always continue to improve, right?
Oh, absolutely. I mean, it's an epidemic, and every day it's a new battleground. Every day it's also a new opportunity.
Right. So can you give us some statistics about about the overdose rates and addiction right now currently?
Oh, absolutely. I think, the most important number is this. The number one cause of death right now in the United States for Americans 18 to 45 is overdose. Now, that is a combination of fentanyl poisoning and overdoses. But that's 18 to 45. And to me, that means that's like the tail end of high school and it's college. That's new families that are getting married in their 20s. And by the way, it's the heart of the workforce in America. So that's very dangerous that the heart of America, the number one killer, is our issue. Now, let me say this. On average, every day in the United States, we average 200 overdoses a day. Now, that's average. And I'll give you two things about that. What does 200 mean to you? It probably means something different than it means to me. But my good friend from Athens, Georgia, Coach Scott Cochran, coach with the University of Georgia football team. He's in recovery. He's the president of the American Addiction Recovery Association. Scott will tell you, Coach Cochran will tell you that what 200 means to him is that when a Division I football team like the University of Georgia goes to an away game, on that plane they travel on, players, coaches, and staff, that's 200 people. And Coach Cochran will say this. He says, what if the UGA plane crashed on Monday and the University of Alabama plane crashed on Tuesday and the Georgia Tech plane crashed on Wednesday? He said, how many days do you think that would go before the people of America demanded the White House and Boeing Airlines and Delta Airlines and the NCAA do something about this? Because people would be like, I can't watch my favorite college football team on Saturday if you're letting them die every day in a plane crash. But no one's doing that for the 200 people dying a day on average for our disease. One more stat. And, this is going to hit home to a lot of people, but it needs to be said. A couple of weeks ago right here in Georgia, right by Athens, Clark County, and Barrow County, there was a tragic shooting at Appalachia High School. I just was at Appalachia High School a couple of weeks ago with the Recovery Month bus. And, we lost 4 lives at Appalachia High School during that shooting. And that's tragic. And every one of those lives, may their memories be a blessing. And prayers to the family. All 4 families. But that made international news over and over and over. I don't mean national news. I mean international news. But that same week in Barrow County, that very same week, there were 4 other people that died from fentanyl poisoning and overdose. And those 4 people in Barrow County that died, I haven't found one news story about them locally, statewide, nationally, and certainly not internationally. And my point being is that that's 8 Georgians who died tragically in one county in 1 week, but 4 of them got no attention. We've got to do better because all these lives matter. And my brothers and sisters dying from my disease, being poisoned through fentanyl poisoning, also experiencing overdose, slightly different nuance, but every one of those lives matters. So that's some numbers. I'll give you some other numbers. In America right now, according to the federal government, they tell us that there's 46 million Americans in active addiction, 29 million Americans in recovery. People that know math much, much better than me, these people probably go to Georgia Tech. They tell me that that means there's 1.3 million Georgians right now in active addiction and 900,000 Georgians in recovery. So this is not just another policy issue. It's not just another issue to talk about at the local Rotary Club or at the local church or at the local bar or at the local, wherever you gather, at the local barbecue restaurant. It's the number one domestic policy issue in the United States because more Americans are dying from it. And those that survive it, like I'm blessed to be a survivor, Jamie, you're blessed to be a survivor, us and our families are impacted with significant financial devastation because we're not even getting it right for survivors in terms of their insurance and coverage for programs. So whether you live or die, addiction ravishes families, and fentanyl is a game changer.
Those are some pretty eye-opening statistics. And thank you for the way that you described them, because that really puts it in people's perspective to be able to understand that this is still an issue that still needs attention. And we are going to bring it some attention on November 19th, right here in Athens, Georgia, at the Bridge Community Church, which is right down the street from me, on Prince Avenue from 6 to 8 on Tuesday night. Now, this conversation, what are we hoping to come to in this conversation?
Well, I'm an old campaign strategist, and there's different kind of events you can put on. This event really is a conversation. We're not coming in at the Georgia Council for Recovery, Larissa Guerrero, our executive director, and we're partnering locally with Shane Sims, a great recovery leader at PLR, People Living in Recovery. We're not trying to stage something where we create an artificial message. We're trying to do just the opposite with this meeting. We want a conversation with diverse ideas, diverse opinions, diverse perspectives, diverse lived experience. We want to actually learn from communities across Georgia what people really think about fentanyl and what they've experienced and what they think Georgia ought to do about fentanyl from a policy, a political, a legal, a law enforcement, a medical situation. Now, you may be listening to this live or you may listen to it later and you may say, that's all pretty boring stuff, Jeff. And I'm not going to go sit down and sit at some church when I could be at home watching TV or like my son playing some video game. I don't care about that stuff. Well, I got news for you. It cares about you. Because you see, in Georgia, they just passed a law that just went into effect on July 1st that deals with fentanyl and Georgians. Now, the first version of that law that was introduced, it had language in that bill that would have sent anybody in the room, if you will, present when law enforcement showed up, to jail for a minimum of 30 years. It's called a mandatory minimum sentence. No distinction about who the people in the room were, what their circumstances were. Everybody goes to jail for 30 years. See you, goodbye. No questions asked. And we, the Georgia Council for Recovery, we worked with the author of the bill. We understood why the senator wanted it in the bill. Worked with the Lieutenant Governor Burt Jones, understood why they wanted it in the bill, but we made the case to them that there's different kinds of people in that room that day. And I get it. If you're a mama or a daddy or a spouse or a sibling or a boyfriend or girlfriend of somebody that just died, you want justice. And look, rightly so. And we understand that, or I understand that. The Georgia Council understands that. And the Georgia Council's position is somebody's got to go to jail. We get that. But if you're in that room, a person with a disease, and you're validating your disease, you don't need to go to jail for 30 years. You need to go get medical help and medical treatment for your disease. Now, maybe not everybody agrees with us on that, but I got to tell you, in Georgia, somebody is going to go to jail. And our position was, well, you can't send everybody to jail. You can't send somebody who's just there because they have a legitimate disease. Now, look, if you're over there making this stuff, this fentanyl, and you're telling somebody there ain't no fentanyl in this crack cocaine, like that was my drug, but there's no fentanyl in this marijuana. But look, if you're doing all that stuff, that's a whole different thing. But our objective was to at least try to make sure that people who legitimately have a disease don't disappear for 30 years in the criminal justice system just because they were in the wrong place at the wrong time. We got that taken out of that bill last year. And that's great. But we've already had more people say, well, guess what? We want to put that back in another bill. Well, that is what we're worried about. So we want to have a conversation. Maybe most Georgians agree with that. Maybe they don't. Maybe there's other things that they think they have ideas about how we should deal with this. But the reality is we cannot sit around in ivory towers and just simply pronounce that we think there should be nothing happen to people where fentanyl is involved, because something is going to happen. And the only choice we have as a community that cares about recovery is do we show up and participate in the conversation. If we don't show up, they'll have that conversation without us. And they'll probably pass laws that we really, really don't like. So that's what we're doing this for, to have a conversation. We'll tape it. We're going to have community comment section time. We just had one in McDonough, Georgia, and we had a panel. So we'll have a panel at this thing and find some people will talk. That'll be great. But then we opened it up for community comments and questions. And the comments to me were the thing. And I mean, people lined up. We had about 52 people there. And I mean, 8, 10, 12 of them got up and said, let me tell you what I think. And that's what we want to know. So that we hear what you think. And we can tell the chairman of the Judiciary Committee. We can tell the majority leader. We can tell the lieutenant governor, the speaker. Let me tell you what we heard from people in Athens. They support this. They don't support that. They had this great idea. Have you ever thought about it? So if you want to have input after this night in Athens, when we meet, it's your chance. It's your chance to say what you think we should do about fentanyl when it gets into our, frankly, the supply of drugs in Georgia.
Mm-hmm. And definitely, I know I'm going to be there. It's already on my calendar. I have been brainstorming with Access Point, about some things, and we're really trying to get into, the prevention aspect, because, we want to get people before they get in that room where somebody's going to get 30 years. We want to get people before that. And it's like trying to come up with, ideas of like, how can we do that in so many different aspects? Where can we meet people, so.
Right. And, that's important. The prevention, the harm reduction, and the recovery, and what's law enforcement's position on this? What's the clinical position on this? If you're like me and you're a peer. So when I was inactive, I've been in recovery for just over 8. October 26th was 8 years for me. Thank my higher power, yeah, Christ, for that, and my family and friends and everybody that helped me get there. But think about that for a minute. When I was out 8 years ago in active addiction, I never once thought about fentanyl. And Larissa Guerrero, I mean, she's a visionary leader, and she and I were talking about this, and we said this at our meeting the other night in McDonough. You can say what you want to say about the war on drugs. We're not here to talk about the war on drugs. But we do believe that Joe Biden's administration, President Biden's DEA is correct about one thing. One pill can kill. One inhalant of a laced product that you didn't know fentanyl was in there. It's not that it can, it's that it does. I mean, it in fact does kill people. And that's a game changer. So we have to, if we talk about like leaders whose shoulders we stand on, like people like Neil Campbell, who kind of built the Georgia recovery community with her will, her sheer force of nature. She's retired. Neil rose to the challenges in her time over the past 20 years. So now her successor, Larissa Guerrero's in there. And the number of RCOs, just like 3 in Athens. I mean, they keep growing. Georgia has 46 recovery community organizations. I am told that's more than any state except Texas. And I want everybody from Texas to know we're coming for you, by the way. And we're going to get to be number one eventually. But 46 is seriously a lot of RCO, recovery community organizations, for those that don't know that. And that's a peer-led recovery place after some sort of treatment path that don't want to get too complicated, but people understand you go to treatment. What happens after treatment? Well, we have these recovery community places so you can maintain your recovery. Okay, great. So in Larissa's time as ED of the council, fentanyl is a thing. And just like Neil had to rise to the occasion as the statewide executive director for the challenges in the past 20 years, we've got to acknowledge that fentanyl is changing the way we have dealt with this epidemic and disease the past 5 years and 10 years. And if we don't get honest about it, if we don't say, what do we say to a mom or dad or husband or wife or brother or sister whose friend took a pill one time at a fraternity party at UGA? They had never done drugs in their lives. They didn't mean to die. They weren't trying to overdose. They didn't even know. They thought it was a legal product over the counter, but it was laced with fentanyl, and somebody willingly put that fentanyl in there. Do we just say the person that will? I mean, I don't know. And we're not here to tell anybody what that is. What we're here to say is Georgia needs to have a conversation about that. It needs to be a hard conversation. It needs to be respectful. We've got to respect everybody's perspective, because there are different perspectives. I assure you that the family who lost the loved one time to one pill has a perspective. But maybe the person who's out there selling it has a perspective too. They're both Georgians. And we're not putting any morality on it. We're just saying it's time to have a conversation.
So I know a lot of people have a lot of different perspectives on how the fentanyl is getting into our communities so heavily. Does anybody have a definite idea of that, of where it's coming from, or how it's getting it's getting almost saturated into everything on the streets?
I'm sure that a lot of people have a lot of ideas. I do think that's something that we're going to have to also address as a nation, all the way from the White House and Congress to state capitals to city councils and county commissions. And frankly, more importantly than any of that, families around dinner tables and friends around the counter at Starbucks when they're visiting together. Yes, that was a cheap plug for Starbucks. I don't own any stock in it. But if you ever want to buy me a London Fog at Starbucks, I'll drink it. Look, I know what I've seen President Trump's DEA present at the RX Summit in public in a declassified presentation. I know what I've seen President Joe Biden's DEA present at the RX Summit in Atlanta, and obviously a public declassified presentation. So it can be bipartisan. Just the the current administration of President Biden and the first administration of President Trump. We can listen to them. And that's the blue team and the red team. And if for a minute you could just decide, okay, these professionals, these aren't politicians, these are professional people that just happen to work for the government. They're not here to lie to us. Well, they've given us data, they've given us intelligence, they have evidence of how fentanyl moves. There was a bipartisan take Biden and Trump out of it. There was a bipartisan hearing in Congress that Hakeem Jeffries, the Democrat leader, endorsed. So it was Democrats and Republicans that talked about the fentanyl coming out of China. I mean, at some point, we have to say the Democrats in Congress, the Republicans in Congress, they don't hate us. They're not lying to us. And we have to accept hard facts of we know where fentanyl comes from. We know how it comes in here. And we know what happens once it gets in here. And somebody and some group of Americans are going to have to decide what we do about it. The Georgia Council, we don't have any of the answers, all the answers. We're not here to tell anybody what you should and shouldn't do. But I do know this. If we say that we care about human beings, and if we say we're tired of we say overdose deaths a lot, but look, I've learned that a lot of those aren't overdoses at all. They're fentanyl poisonings, right? I mean, look, there were like 4 guys that died at a Super Bowl party out in Missouri, right? I mean, drinking some beer and they split 2 pills up. I mean, they weren't doing what I used to do. They just took half a pill to feel good at and I'm not saying that again. I'm not but they certainly weren't trying to overdose.
Right. Mm-hmm. I heard
but
about
there was
that too at
fentanyl
a
in what they
club.
took, and they died right there.
Mm-hmm.
So what do we do about that? And that's what we want. Your voice. We want your opinion. We want your ideas. We want your feelings. We want your facts. Because look, we all need to express our feelings for our own self-care, but we need facts to deal with legislation and laws. But one fact is this. If you say you're a member of the Georgia recovery community, well, you better show up and participate in the conversation, because if we don't show up, if we don't participate, if we don't bring our elected officials serious policy ideas, I promise you other people will, and we may not and almost certainly won't like their ideas. Because there are still people that show up at our state capitol. And, I posted a post on my social media and the council's social media. Is this lady good or bad? You decide. She shows up, stands up there before the Senate Health and Human Services Committee, and she says the only reason Jeff Breedlove wants this bill passed is so that he and his drug addict friends can get taxpayers to pay for their drugs. Now, she said that in public at our state capitol, at your state capitol. That's, to me, the voice and face of stigma. And by the way, stigma is a polite word for hate and discrimination. So in other words, this lady brought some hate and discrimination down to the Capitol. Now, she didn't win that day. We won that day. But what if we hadn't been in the room that day?
Mm-hmm. Exactly. Because they're going to hear their voice, or they're going to hear our voice, or they're going to hear both. And
right. And that's what
right.
you get a chance to do in Athens when we have this wonderful event called Fentanyl in Georgia, a conversation, hosted again locally by our friend Shane Sims and his friend at his group, his organization, People Living in Recovery, our friends at the Bridge Community Church at 973 Prince Avenue on Tuesday, November 19th at 6:00. So the Georgia Council will be there with People Living in Recovery. We want you to come. We want you to bring your friends. I know PLR is posting about it on their social media. I know the council's posting about it on theirs. I'm posting about it on mine. Share those posts, share those invitations, bring your voice and let your voice be heard. The Georgia Council respects every voice in Athens and the surrounding area. And we want you to come tell us so we can go back and tell Governor Kemp and his staff, so we can tell the General Assembly members, so we can tell the Georgia Municipal Association and the Georgia Sheriff's Association and the Georgia Association of County Commissioners what Athens and the surrounding area think about this. If you don't show up, your voice doesn't count. If you show up, your voice counts more than you know.
Absolutely. Absolutely. And for all my CARES friends out there, you better show up because that's what we do. CARES, show up. I was just explaining that to someone from from New York, actually explaining CARES. And I was like, yeah, CARES, we show up. And he's like, what does that mean? I'm like, it means we show up when stuff's going on. Like, we show up, like we advocate. We're a voice. We show up for each other. And
we show up. CARES 37, by the way, is the best. I just want to say that.
CARES 32 in the house.
Now, I hope every CARES shows up. There's not only 3 recovery community organizations in Athens itself. There's other organizations out there in Athens that I've had the privilege to visit. I don't want to start name dropping because I'll leave one out, but there's several wonderful nonprofits and even for-profits in Athens that care about our community. And if you're involved in one of those, if you've benefited from one of those, this is your chance. If we get a bunch of people in that room at that church that night, I'll make you one promise. They'll hear your voice at the state capitol and they'll hear your voice in Congress. Your voice will be heard. But your voice is the power. And you're the ones with the ideas. You're the ones with the lived experience, the perspective. And we need to know that perspective and those ideas so that we can find laws and rules and regulations that benefit us and don't discriminate against us.
Absolutely. We are the experts. We are the experts. Awesome. Well, I just want to shout out my shirt.
There you go. There you go.
Access Point. My kid, Narcan, your honor student.
I will shout them out too. We love Access Point. Yeah. Yeah. Just with our friends, Unity Recovery in Pittsburgh, they do a lot of harm reduction work, and Access Point, a leader here in Georgia. Great work there. By the way, we don't want to miss the opportunity to remind you that on your long-term planning, not that long, so here's what's going to happen. Check this out. January 20th is both Martin Luther King Day. It's also Inauguration Day in Washington, so that's great. Then January 21st is Addiction Recovery Awareness Day at your Georgia State Capitol. And last year we had about 1,300 people. And if you weren't there, you missed out. And if you were there, you know how cool it is. It's always free. There's going to be some free food there. And
great speakers.
Great speakers. There'll be vans and buses and carloads coming from Athens. Talk to one of the recovery organizations and mental health organizations in Athens. They'll know about it. And then on January 22nd, right back at your state capitol, is Mental Health Day this year. So there's 2 days back to back, the 21st and the 22nd. Important to our community down at the Capitol. And go ahead and mark your calendars for January 21st, January 22nd, and do your best to get off work that day and find a way to get to the state capitol and let your voice be heard.
Absolutely. I will be there. I'm super excited. Always have a great time seeing all my friends there. Well, thank you so much, Jeff. And thank you so much for Georgia Council for Recovery. I am always bragging on you guys and our Department of Behavioral Health and Disabilities also, just for the amazing leadership and work that you guys do. I mean, I don't know how other states' recovery communities work, but I believe that ours is the best and a forerunner, definitely in the nation. So proud to be part of the Georgia recovery community and super excited to see everybody on Tuesday night at 6:00. Make sure you guys message me. I live literally 2 minutes from there. So, I get off work at like 4. So if you guys want to meet up first and go like get some food or something, there's a coffee shop right across the street. There's Agua Linda. There's a Mexican restaurant. So you guys message me if you want to meet up for Mexican, and we can kind of brainstorm some ideas so we can have a very loud voice and specific ideas when we go in there. So
Wonderful. Well, listen, Jamie, thanks for the kind words about the council, but we're nothing without our strong recovery community organization network. 3 of the very best are in Athens, Georgia. Thank you to everybody at those 3 recovery community organizations. Thank you for people like you who bring a powerful voice consistently. You demonstrate through all of your activity what recovery advocacy is. Thank you for demonstrating regularly what advocacy is for recovery. And I'll just end by saying recovery is real.
absolutely. Recovery is real. Okay, you guys, we will see you on Tuesday nights. Thank you.